歡迎大家。
Welcome to today's press briefing. We have with us Head of the Communicable Disease Branch of the Center for Health Protection, Dr. Chuang Shuk Kwan, and Chief Manager of the Hospital Authority, Dr. Lau Ka-hin. The two doctors will give us an update about cases as well as the Hospital Authority. Dr. Lau, good afternoon. Let me give you some information about the situation in the Hospital Authority. Currently, there are 2,598 confirmed patients staying in our hospitals. 355 of them are new cases. Those staying in isolation facilities, there are 513 in isolation wards, 176 in second-tier isolation wards, and 617 of them are in the North Lantau Hong Kong Infection Control Center. 218 of them are in the Asia World Expo treatment facilities. 258 of them are new cases. Yesterday we reported 14 critical cases and 13 serious cases. Among those staying in hospitals, there are 53 critical cases and 41 serious cases. 15 critical cases are in ICU. Of death cases, we have reported 9 additional cases, 5 males and 4 females aged between 34 and 97. 7 death cases have not completed 3 doses of vaccination, and there are 2 patients that have not received any vaccination. I will give you more information. First, the 34-year-old patient who passed away is a male. On the 27th of August, he tested positive by RAT on the afternoon at around 6 o'clock on the 29th because of swelling and pain on the legs, fever as well as diarrhea. He went to North Lantau Hospital for treatment. His blood pressure was low. He felt dizzy. The A&E department transferred him to the Princess Margaret Hospital infection ward. We took an X-ray of the lungs for him. It was in order. We have also done an ultrasound check. His heart was normal. At about 9 p.m., he was transferred to Princess Margaret Hospital. He was prescribed with antibiotics, drugs for blood pressure, as well as to thin his blood because we suspected that he suffered from vascular thrombosis. We took blood from him for tests and found that his red blood cell was of a high level. It might be a case of white blood cell growing excessively. At about 45 minutes past 4 o'clock in the morning, his blood pressure plummeted. His condition worsened. He was intubated. We consulted doctors of the ICU, and around 5:30 a.m. We lost his blood pressure, and we resuscitated him, but he passed away. It might be the case that's related to that hidden condition of excessive growth of white blood cells and the vascular thrombosis. It might not be related to COVID. The patient has received 3 doses of vaccine. Another case is a female, 84 years old. She suffered from diabetes as well as lymph node cancer. On the 11th of August, she was transferred to the Hong Kong Infection Control Center because her PCR was positive with a CT value of 18.3. She was prescribed with antiviral medication. Her appetite was poor and she felt dizzy. And on the 23rd of August, we found that there was hemorrhage in her upper digestive system. She was transferred to Princess Margaret Hospital, and on the 23rd she passed away. Her death might be related to the hemorrhaging. The third case is a 75-year-old male suffering from Parkinson's disease, hypertension, and a high blood lipid. On the 20th of August, he was sent to the A&E department because of fever as well as fast heart rate. And we found that he was suffering from cardiac fibrillation. PCR test was 22.1. He was transferred to medicine ward. He was prescribed with various medications, including antiviral drugs. The fever continued, and there was a shock because bacteria has entered his blood vessels. He passed away. And the third case is an 83-year-old male, unvaccinated, suffering from diabetes, has had a stroke, coronary diseases, as well as cardiac fibrillation, atrial fibrillation. On the 12th of August, because of cough and phlegm, he was sent to Pok Oi Hospital. He was tested positive PCR with a CT value of 23.1. On the 23rd of August, he started to suffered from speech impairment, and we took an X-ray and found that he had a stroke, and he passed away on the 30th of August. I think his death was more related to the stroke. The other case is the 90-year-old male with 2 doses of vaccine, suffering from hypertension, high blood lipid, as well as diabetes. He suffered from a late stage of lung cancer, with the cancer spreading to other places. On the 11th of August, because of cough, phlegm, as well as shortness of breath, he was sent to A&E department. The PCR result was 20.1. He was transferred to a ward. Because of the lung cancer, the lung condition continued to deteriorate, and he suffered from breathing problems and passed away yesterday. Another case is an 83-year-old female suffering from bladder cancer. She had 3 doses. On the 29th of August, she had a fever, shortness of breath, delirious, and she was sent to A&E department. The PCR test was at 17.9. Her condition deteriorated rapidly, and she passed away yesterday. The other case is a 95-year-old female. On the 24th of August, she went to the A&E department because of lethargy, shortness of breath, and serious phlegm. The RAT was positive. She was transferred to a ward. PCR test was positive, CT value 22.4. She was prescribed with 2 antiviral medication, but she passed away yesterday. The other case is a 97-year-old female suffering from a high blood lipid as well as diabetes. On the 4th of August, she went to the A&E department because she suffered from convulsion for 10 minutes and was unconscious. On the ambulance, she was found to be suffering from low blood sugar. She was given glucose, and she regained consciousness. She was transferred to the ward, and she was prescribed with oral antiviral medication. She passed away yesterday. The last case is an 81-year-old male. He suffered from hypertension, Parkinson's disease, as well as dementia. On the 12th of August, he tested positive by RAT. He had a sore throat, runny nose, cough, as well as a low fever. On the 14th of August, he went to a designated clinic. He was prescribed with antiviral medication. He recovered. The RAT result was negative. However, yesterday he lost consciousness at home. He was sent to an A department by ambulance. His vital signs were absent when he arrived at the hospital. He passed away. Ambulance men were asked questions, and we found that his death is not really anything to do with COVID-19. We asked his families. The RAT was negative, and he actually recovered.
Now, the number of recovered patients, we had 332 patients who recovered. Among them, 284 have been discharged. We have got 15 patients are confirmed via admission screening or testing when hospitalized, and 26 patients in the same ward are now close contacts. For staff, we have another 174 staff members confirmed, and 124 more staff members have returned to their posts. That's all from me. Good afternoon. Yesterday, we had 9,267 confirmed local cases, 3,054 confirmed by PCR, and 6,213 cases confirmed by RAT. We've got 228 imported cases, PCR positive 193, RAT positive 35. Among the 228 imported cases, 110 were picked up at the airport, at quarantine hotels, and in community testing centers, 59 positive cases. Samples collected on day 4 and day 7, 51 positive cases, and also samples collected on day 8 and day 10, 8 cases with rather high CT values. They are likely to be positive cases. The 208 cases came from 51 countries. 7 places have imported more than 10 cases. UK 32, US 20, Thailand 18, India 16, the Philippines 14, France 13, Vietnam 11. And the remaining 44 cases has imported 10 or less than 10 cases to Hong Kong. As said by Mr. Lau, we've got 9 cases of death reported. As of now, in the 5th wave, we have lost 9,477 lives. For care homes, we've got a few care homes with cases, and a quarantine is required. 4 homes for the elderly and also 4 for the disabled. Ming Oi Lai Gok Yuan in Sam Shui Po, 1 resident confirmed, 3 quarantined. Kwai Hong 護老中心有限公司 in Kowloon City, 1 resident confirmed and 4 residents quarantined. Yu Dat 護老中心 in Kwai Chung, 1 resident and 1 staff member confirmed, 4 residents quarantined. 瑞興護老中心有限公司 in Kwun Tong, 2 residents confirmed, 13 residents quarantined. 新生精神康復會賽馬會農舍 in Tuen Mun, 1 resident confirmed, 3 residents quarantined. 香港善道會秦石 halfway house, 1 resident confirmed, 5 residents quarantined. 新生精神生學會思成園 in Sha Tin, 1 resident confirmed and 9 quarantined. Tongwa Group Hospitals, 李興田父子樂活庭, 1 resident confirmed and 4 residents quarantined. As far as schools are concerned, today is Wednesday. 82 schools have reported 131 positive cases to us, including 97 students and 32 teaching staff, coming from 40 KG, 17 primary schools, 24 secondary schools, and 1 special school. In the past 7 days, schools that have reported more than 2 cases to us, there are 24. We have advised 1 KG, 1 class to be suspended for a week. Cloudview Road, North Point, 合一堂陳伯雲紀念幼稚園, N5, 1 class with 12 students and 2 students positive. So the class has to be suspended for a week. For subvariant, suspected BA.4/5 proportion continues to rise. Today is 59.7%. So for BA.4 and BA.5, we have got about 50 to 52%, and BA.4 about 7%, BA.2.12.1 about 6%, and the rest 34%. They're mainly BA.2.2. Right, the floor is open to questions. Please identify yourself and also the organization you represent. Second row, right hand side. This is from Phoenix TV. Mr. Johnny, the chief executive, has cancelled his visit to the mainland, and the meeting on reopening of the borders will be postponed. I'd like to know whether one border control point can be opened before resumption of normal travel, so that there can be a way for officials. As said by Mr. Johnny, this is on the agenda, and we don't have any details, and it's not convenient for me to comment on that. Next, the lady on the right, first row. I'm from Orange News. Now for HA, we're told that there is a great rising demand for designated clinics and also telemedicine consultation. I'd like to know the utilization rate, and I'd like to know whether there is a remarkable rise in the demand for services by the elderly and children. And what about the use of oral COVID drugs? Even though after taking them, some cases have passed away, although the viral load has reduced. I'd like to know whether that means they have already recovered and no complications will arise. I'd like to know the possibility of death even after taking the full course of COVID. And for the 81-year-old male, it said that he has recovered, and then we're told that the cause of death was not COVID. So what was it? And has he taken the full course of oral COVID drugs? Now for services provided by designated clinics and telemedicine consultation, as I said, we're increasing the daily quota because we have observed a rising demand for services. Let me see if I've got the statistics with me. On average, we are seeing close to 2,000 patients per day. That is designated clinics and medical consultations taken together. So we'll monitor the utilization and we'll increase the quota so the members of the public can make an appointment to see a doctor as soon as possible. This is particularly true for those who are 60 years old or with chronic diseases, because after they've seen a doctor, they can be prescribed with medication ASAP. I think you have to understand that literature all over the world has said that taking new COVID oral drug can help to reduce the need for hospitalization or serious conditions or even fatalities to the extent of up to 80%. All right, some patients have taken new COVID drugs, but unfortunately they still passed away because we are talking about thousands of patients. As yesterday, 1,400 of patients have taken the COVID oral drugs. Now, for those who have recovered, they will not be reported here. The drug was useful in treating their condition. So please do not get this wrong message. Do not judge by the condition of 1 or 2 patients and ask whether the drug is helping or not. This is certainly not the case because we rely on science and real data. Many studies have shown that after taking new oral COVID drugs, death and serious conditions can be avoided. And we are talking about over 1,000 patients taking the drug per day, and 1 or 2 might pass away, unfortunately. And for the case is already 81 years old with other underlying diseases. So after taking the medication, he improved. That was according to his family. For reasons unknown to us, he suddenly went into shock and lost consciousness. Now, even for elderly persons, even if they have not contracted COVID, they may deteriorate to this condition, perhaps because of heart disease or stroke. So we have to find out the reason. Because the patient passed away at A&E department, we'll send him to a public morgue, and forensic examination will find out the cause of his death.
We spoke to his family members, obtained his medical record. We all think that his death is not really anything to do with COVID. We try to find the reason. We ask you not to interpret this case wrongly, that antiviral medication did not help, because after taking the antiviral medication, we saw that his condition improved rapidly. Please send the right message to the general public. If you are over the age of 60, or if you are under the age of 60 but suffer from chronic illnesses or other high-risk factors, should you be tested positive whether by RAT or PCR, please see a doctor as soon as possible to get COVID medication to protect yourselves. The lady over there, I'm from cable TV. I want to ask about the 34-year-old death case. The condition deteriorated rapidly because there were thrombosis. Does it mean that the COVID has made the leukocytosis worse? And there was a report saying that for private hospitals, the number of beds available has increased from 364 to 380, an increase by 20 beds. Is it slow for private hospitals to release more beds for your use? So there are only 380 beds in private hospitals for use. Is that enough? Do you have any other incentives to get private hospitals to release more beds? Well, yesterday 168 people did not do the test, and 24 of them were fine. As of today, were more people fined for not doing the test? Are you still waiting for evidence? Do you expect that there will be more checks to see if residents under the restriction and testing order has been complied with by residents? For the 34-year-old male who passed away, when he was admitted, we found that his red blood cell was high, so there was an excessive growth of red blood cell. Well, if that is the case, that there is a chance of a blockage in his blood vessels. If there is an excessive amount of red blood cell, so the thrombosis is a sign that it might be something to do with polycythemia. And the condition deteriorated so rapidly because of pulmonary artery thrombosis. If that is the case, the condition might deteriorate rapidly and may result in death. That's our clinical finding. relevant experts told us that his condition might not be entirely relevant to COVID. It's because of his polycythemia that caused his condition to deteriorate rapidly. In relation to private hospitals, we thank them for rendering assistance in such a short time. We have St. Teresa Hospital, St. Paul's Hospital, and another private hospital. They have increased the number of beds available to us. We understand that there are more and more private hospitals releasing more beds for us. Today, our utilization rate of hospital beds are 70%. It's not a fixed percentage because there will be patients being discharged and at the same time patients being admitted. So there is a constant turnover. In the end, we said that we would like to see 1,000, but we will do it gradually. We'll continue to talk to private hospitals. As you have learned today that the number has increased, we will choose suitable patients to send them to private hospitals. We have worked out a smooth way for transfer and for a mechanism to go forward. This is a good initiative because it will relieve pressure on our hospital beds.
From RTHK, would you expect cases to go beyond the 10,000 mark soon, and when would that happen? And do you think there will be more cases when school starts again tomorrow? And another question for Dr. Lau, with more COVID patients being treated in hospitals and possibly putting more burden on public hospitals, which patients would be prioritized to be admitted, and what would be the criteria? And also, would more private hospital beds be used to treat patients so that public hospital beds can be freed up? Thank you.
I think the general trend of the COVID cases in the community is still increasing. So we expect the cases number will exceed 10,000 soon.
As what I have said yesterday, now nearly more than 80% of our COVID inpatients are elderly who are aged over 60 years old. And more than 65% of the newly diagnosed or admitted patients who are COVID patients are more than 60 years old. That means we are admitting quite a lot of elderly into the hospital for the treatment of the COVID as well as other medical illnesses. Because we know that many of the elderly have other medical diseases. For example, hypertension, some of them even have cancers. So we are screening the cases according to our clinical judgment. That means we will admit the case who are clinically need to be stayed in hospital. For example, who need the intravenous fluid, intravenous drug, or sometimes you need the oxygen. So the mild case who can be cared at home will not be admitted at this moment because we want to reserve our bed for the serious case, for the case who need to be stayed in the hospital. For the private hospital, first of all, hospital authority would like to thank the private hospitals to provide the beds for us at this critical moment. We know that some hospital, for example, St. Teresa Hospital, St. Paul Hospital, as well as the CU Medical Center, have increased the number of beds provided to the hospital authority today. So at this moment, we have at least 380 beds that we can download or discharge our patients to the hospital, to these private hospitals. We will continue to liaise with the private hospitals to increase the number of beds when the COVID admission is increased. At the same time, we will try our best to find more suitable cases, for example, those patients who are in the recovery phases after the operations or after some medical illnesses. And our communication, our working relationship with the private hospitals are much better now. So the turnover, the number who are admitted to the private hospital is increasing in the past 1 or 2 weeks. Thank you.
下一題，右手邊後排。
Next, the one in white at the back. I'm from Now TV. We have over 9,000 cases today. Do you expect the number of cases to exceed 10,000 very soon? What corresponding measures do you have? Or will you consider tightening social distancing measures? A new term will start tomorrow. Will a new school term start as scheduled? Well, in the past few days, we have been saying that the number of cases in the community has been rising. So it's expected that the number will exceed 10,000. Next, the lady in the front row. I'm from TVB, Dr. Lau. With regard to the 34-year-old patient, so was it really leukocytosis or polycythemia? Because at first you referred to his white blood cell and then later you talked about his red blood cell. Can you elaborate on that? Now tomorrow a new term will start. How do you assess the possible number of cases from schools? Do you have any appeal to schools, please? Perhaps I should take the question first. The number of cases in the community is rising. And we will require teachers and students to have RAT negative results before returning to schools. This is to prevent positive cases from going to school, spreading the virus there. Well, I think I made a mistake in the beginning. It should be polycythemia because on a mission we tested his blood and his red blood cell count and hemoglobin was high, and then his blood would become thick, leading to clotting, and so there was possible heart vascular thrombosis. We have to explore more to find out the real cause of death. But clinically, we prescribed him with drugs to deal with thrombosis in his heart blood vessels or deep. He was suffering from deep vein thrombosis, but then a heart problem can cause him to deteriorate very quickly. Now, according to HA, individual private hospitals can admit more patients, and HA has taken the initiative to meet with them. Can you give us details? What requests will you put to private hospitals? And we were told yesterday that you are more inclined to activate more beds in hospital clusters first, but today you have admitted more than 200 new patients. I'd like to know when will you decide activating more beds in AWE? And for Shui Heng elderly care homes, 2 residents were confirmed and then 13 are in quarantine. Can you give us more details? And we're told you are going to monitor the demand for services in designated clinics and also a telemedicine consultation. Are you providing 3,000 places per day, and will you boost service because of a new term? Now, for Shui Heng elderly care home, on the 30th of August, 2 positive cases were reported to us. One involved 1 room, and the other was staying in a single room. But then the first patient would eat in the dining hall without any partition. So residents who ate together in the same dining hall have to be quarantined. Now, for private hospitals, If we look at the number of beds available and also a take-up rate, they have been rising because we have discussed with senior management of some private hospitals. Sometimes there may be some misunderstanding, and they may not know whether some patients could be suitably transferred. Now, we are all in the healthcare sector. We share a common goal, and that is to provide best services to patients. With this intention in mind, we can always discuss. And after our discussion and agreement on transfer and also types of patients to be admitted, with this understanding established, things become easy so as to maximize the beds available. And as take-up rate increases, private hospitals can consider adding more beds. As I said, 3 private hospitals and announced that they can provide more beds. We have at least 380 in private hospitals now. We will keep monitor the capacity of private hospitals. Now, for AWE, it's true that for the time being, we use existing manpower because we have part-time colleagues. We have private doctors and also colleagues working. Our nurses working in the private sector have come back to help at AWE, so we have a little bit more manpower to open more beds in AWE. But if we need to add beds substantially, we need to deploy manpower from our clusters. So it's a balancing act. We have to consider the level of manpower to provide the maximum number of beds to take care of a maximum number of patients. There are bound to be some flexibility, and at the end of the day, it is for our decision-making committee in headquarters to consider the 7 clusters and also the AWE and also ICC on how to best use our beds. And for the quota of our designated clinics, we keep monitoring the situation. For instance, we'll see whether there is any slots available today or tomorrow, and then we will deploy manpower based on the quota. Now, we made manpower available for 2,200 slots, and then now it's 3,300. We understand that there are more confirmed cases, and though some are over 60 years old, most members of the public understand that COVID medication can help to reduce serious conditions and even fatalities, and more people are using this service. Some elderly persons may not know how to make an appointment. Their children can help, and when their children help them to make appointments, more people can then use our services with only one objective, and that is to make available services to members of the public ASAP. No matter whether we talk about services of our designated clinics or telemedical consultations, so that they can take medication and improve their condition. The lady at the back. Good afternoon. I'm from HKET. I'd like to ask about the number of RAT positive cases declared to you. You do random verification. I'd like to know the percentage and also the number of false positive identified. And what about the AWE? I'd like to know the average stay number of days. And then Professor Hui Shichang released research, and that is after taking MSW and also Pfizer, the result is not very different. Can you elaborate on that? Now, for cases announced today, some of them were confirmed by PCR. We are verifying about 50% of the case. The percentage of false positive is very low, and we'll continue to see and then adjust our percentage of verification.
In relation to manpower at AWE, our initial estimate was 100 nurses, allied health professionals, as well as nurses. We thought we could operate about 200 beds. But there are some locums coming back to help us. And if we want to operate 300 beds, then we would need to deploy manpower from different clusters. In relation to the COVID medication, oral medication, we have data from different places, and it showed that they are 80% effective in reducing serious cases. Of course, all comments made by experts will be looked into by us to see what are these studies, what are the results, so that we draw reference to adjusting our treatment program. I'm from Ming Pao. I would like to ask about the oral medication. How much medication have you prescribed? And in relation to Pfizer and MSD oral medication, they've been used for quite some time. Are there any difference between the two when it comes to reducing serious cases? Previously, priority was given to the use of Pfizer. Does it mean that clinically, are there cases when clinically they should be using Pfizer but the patient chose MSD? How many of such cases? And what reason? You mentioned about AWE. How many beds are operating there? There are 218 patients staying there. How much manpower will you need if 300 beds are operated? I want to ask about the 17-month-old baby. What's the latest about that baby boy? Are there any results from the MRI? Has it been done? Which sublineage did he contract? As at the 25th of August, we have, for over 64,000 patients, prescribed the two types of medication. Over 28,800 patients have received molnupiravir, and over 35,100 patients have been prescribed with Paxlovid. And over 15,600 patients received the medication either through inpatient or the A&E department. The rest are from designated clinics or teleconsultation. We have a set of guidelines or protocols that doctors would follow in the prescription of these medication. As we've said, if you're over the age of 60, whether you're vaccinated or not, as long as you are COVID positive, then you can be prescribed with the medication, save and except contraindications. And if you're under the age of 60, if you suffer from chronic illnesses, say hypertension, diabetes, or other high-risk factors, then you may be prescribed with COVID medication. But obesity is another reason. Doctors are advised to prescribe Pfizer medication first because we have made reference from data and scientific evidence. The Pfizer medication is more effective when it comes to reduction of serious cases. So doctors will see whether there are contraindications or other conditions that is not suitable for the prescription. Without these conditions, then of course the most effective medication will be prescribed. With our existing manpower, we can operate about 200 or so beds at AWE. And that's the current number. We have additional locum helping us, so we are able to manage. If we are to increase the number of beds, we will have to draw manpower from the clusters. We have a list. But if we take manpower away from clusters, then other services, COVID-related or not, will be affected. So we have to make sure that there are supporting arrangements in place before we make that move. For the 17-month-old baby, he's still staying at a pediatric ICU and relying on a respirator. The current condition is still critical. So far, we don't have any test results or reports in relation to the sublineage. That's the end of the press briefing. Thank you. I think that relevant management, say for example precious blood, hospital authority clusters, are in active conversation to see what more we can do. At the beginning, there were some teething problems when we don't fully know what the other's situation was. But with better communication, things will start to run smoothly. This will take time, and it is being done at the moment.